In other news tonight, a new report on the city dump is calling for immediate action to address the issues at the New Providence sanitary landfill that has been plagued by frequent fire, the most recent in March of this year. Officials of the Pan American Health Organization visited the facility in April and compiled their findings. Cleopatra Murphy has the details on the report, as well as the actions government is taking to address the recommendations made.
A 28-page report from the Pan American Health Organization has branded the New Providence sanitary landfill as an urgent public health hazard and recommends intervention to stop people from being exposed in the short term. The report that was carried out in the wake of the massive March 5th fire at the landfill that lasted 3 weeks and displaced residents of Jubilee Gardens and Victoria Gardens warns that landfill-related exposure could lead to health hazards both on-site and in the surrounding communities. Health Minister the Honorable Dr. Dwayne Sands shared government's short-term goals to address landfill challenges.
There has to be a particular approach and an availability of staff to identify when spontaneous combustion occurs, to ensure that it's put out as quickly as possible, to ensure that the garbage is compacted and covered on a regular basis until such time as we can, as I've used the term before, deconstruct the site and use a different approach moving forward. So bulldozers, people to run the bulldozers, enough fill to cover the daily collected garbage.
Other plans include enhancing landfill security, including emergency plans for surrounding communities and a national communication campaign to discourage the use of private wells.
We are going to follow the recommendations of the Pan American Health Organization in terms of the screening of a particular group of individuals to determine the chronic exposure, and we, having initiated the formation of a task force, are prepared to have a hotline to answer any questions that the public may have.
The report listed biological threats that can result from inadequate waste disposal. Smoke from wood and tires, asbestos, and air particles were listed among others. Air, dust, soil, and water are areas of concern, with the report pointing out that in the days after the fire, clinic staff reported an increase in patients being treated for respiratory symptoms. The report concludes that the water table and aquifer are at high risk of being polluted by the landfill and can be a health issue for those using private wells. The report also notes that landfill employees who work without proper protective gear and are not receiving health surveillance needed for those exposed to hazardous chemicals are vulnerable to effects. Pregnant women in the surrounding communities, the elderly, and children are also at risk, with the report stating children are especially vulnerable because they respond differently to environmental factors and their immune systems are not matured. The health minister says the report was available from late April, but was not made available to the public.
We, as an administration, were quite surprised that the previous administration had received this report. And despite the findings, had not released it to the public to allow the public to at least be appraised of the health and environmental concerns.
According to the report, the Paho team also observed the septic sludge and handling facility that was constructed as a 3-lagoon system. The report says the facility is being improperly used, with trash and oil being disposed off in 2, and the third is overgrown with vegetation. The report says immediate remediation and temporary closure is necessary to remove the accumulated oil, solid matter, and vegetation. Sands says the government will work to ensure that issues at the landfill are addressed in the long term. Cleopatra Murphy, ZNS Network News.